Pranams. Namami Dhanwanthari Adidevam Surasurai Vandita Padapakam Loke Jara Rukhaya Mrityunasham Adhara Nisham Vividausham.
I bow and humbly request Lord Dhanwanthari, who is the embodiment of perfect health, respected by great seers and evil people, to remove old age, disease, fear, and death through his divine presence in all natural herbal medicines.
We start the session with the perfect saying from Vinci Lombardi. Perfection is not attainable, but if we chase perfection, we can catch excellence.
A warm afternoon to one and all present here with us today, as we all here gathered to celebrate an auspicious occasion of our stream. Today, we celebrate our National Ayurveda Day of 2020. I, Rupika Bhaskar, and Tejashri will be accompanying you throughout this entire section.
Practice to observe the Ayurveda Day, which falls every year on Dhanwanthari Jayanthi, was started by the Ministry of Ayush in 2016.
The objective is to focus on the strengths of Ayurveda and its unique treatment principles to work towards reducing the burden of diseases and related mortality. It also aims to tap into the potential of Ayurveda to contribute towards the national health policy and national health programs to promote the principle of healing in society, said Ayush Ministry in a statement.
Samudra Manthan has a central place in Hindu mythology. Simply put, the Manthan is a creation legend in which the demons and deities churned an ocean of milk and brought up many things, good and bad, into the world. Dhanteras is said to be the day when goddess Lakshmi and Kubera, the god of wealth, emerged from the Milky Ocean. For this reason, Dhanteras is considered auspicious for making big purchases and new beginnings in many parts of the country. Dhanteras is also dedicated to the Hindu god of medicine, Dhanvanthari. Since 2016, the Ministry of Ayush has been observing this day as National Ayurveda Day.
The potential role of Ayurveda in the management of corona disease will be the focus of this year. Ayurveda for COVID-19 is the year theme of 5th National Ayurveda Day. Let's start our day with the essence of deity.
Namami Dhanwanthari Adidevam Surasurai Vandita Padapakam Loke Jara Rukhaya Mrityunasham Adhara Nisham Vividausham Sri Radhe Duritam Devam Namami Dhanwantaram Nityam Nanangada Nishodhanam Nanangada Nishodhanam Saraswati Namastubhyam Varade Kamarupini Vidyarambam Harishyami Siddhir Me Sada Nityam Shuktam Nirakaram Niranjanam Nityabhutam Chidanandam
Thank you for a fervent oration asking for a divine guidance.
I request Dr. Kritika, a respected principal, to welcome the forum.
Namaste and my humble pranams to one and all. First of all, let me tell the sorry that I'm unable to come in the video because of some technical issues. I'm sorry. Nanda Education Institute, the management of Nanda Education Institution, and behalf of Ayurveda College, I welcome all the participants and especially a special welcome to my respected Guru, who is the guest speaker today, Dr. K.T. Jayakrishnan. My humble pranams, sir, and I seek your blessings on this auspicious day. And I thank a respected teacher who has amidst the busy schedule, he has consented to be the chief speaker, guest speaker today. Thank you, sir, and we welcome you on behalf of Nanda Education Institution. I also welcome my dear colleagues and my dear students and all the participants, those who have participated in this national webinar on this auspicious Dhanwanthari Jayanthi with the blessings of Lord Dhanwanthari on this auspicious day. Let us start this webinar. Thank you. Thank you for participating in this webinar.
Thank you, ma'am.
Hello. Hello.
Yes, sir. I request Dr. Sandeep Vishwanath, sir, to introduce our esteemed chief guest to the gathering.
Namaste, one and all present here. So, last 8 to 10 months, we are hearing only one word in our life: COVID-19, Corona. This kind of words only we are hearing since last 9 months. So that disease affected our life in such a way that all the nation, not only the one nation, all the world is suffering from it. Not even a single country in this in this world has not reported a single case till now. Okay, and allopathy system, they are even though they are trying hard to fight with the cases, there is no direct remedy in the for this novel coronavirus. So nowadays they are approaching as a symptomatic approach to treat these cases, and up to an extent they are succeeded, but not completely. And all of us are waiting for a vaccine for this novel coronavirus. And unfortunately, it is not a near future to release a vaccine against this disease. In this occasion, we are all the world is looking at our science, Ayurveda, for the solution of this disease. Is there any for the last 8 or 10 months? The Ayurveda people might have heard 100 times the question: do Ayurveda have a remedy for this coronavirus? So, yeah, our answer is yes, and we have treatment, but we don't have a treatment directly to the coronavirus. We can approach according to our principles. Yes, we can treat it. And regarding this Ayurveda day, of course, in this scenario, there is other choice for the topic other than COVID. So our Ayush Ministry selected COVID-19 as the topic of discussion in this Ayurveda day. And on behalf of our college, we got an excellent speaker for presenting this topic, post-COVID management in Ayurveda. Dr. K.T. Jayakrishnan. Sir completed BMS from the famous VPSV Ayurveda College, Kottakkal, in the year of 1986 and served Ayurveda College, Coimbatore as a professor in Department of Rajana Sharira, Deputy Medical Super, and till 1999. And thereafter, he has served as professor and HOD in the Department of Rajana Sharira and also the medical superintendent in SJS Ayurveda Medical College, Chennai. Presently, he is working as a chief physician in Shanda Ayurveda Hospital, Chennai. Yes, sir has excellent clinical experience and academic experience in the field of Ayurveda from 1987 to 2020. It's almost 30 years of experience, more than 30 years of experience. And sir has presented lot of papers in national, international seminars and served as a resource person in lot of international conferences, and also attended as an examiner in various universities across India, and also visited Brazil for the sharing the clinical experience and taking classes for Ayurveda regarding Ayurveda for the people of Brazil. We welcome you, sir, for the excellent session. Thank you.
Thank you very much. So, good afternoon, everybody. Am I audible?
Yes, sir. It's audible, sir.
Yeah. So, first of all, let me thank the management, respected principal, staff members, and the students who all together invited me to be among you to discuss about the post-pandemic situation. We all know, even today morning, I think one session chaired by the respected Prime Minister of India, WHO has already told that Ayurveda has a bigger role to play in managing the pandemics like COVID and all. They are also planning to start some sort of a research center in India in association with the Government of India. Probably they are trying to take the research programs forward as a part of their routine work of promoting the traditional systems of medicine all over. So India stands first in that. Probably as Prime Minister told, to show that the commitment of our great science to the benefit of the society at large. So from that angle, I thought I will talk about this COVID-19 for a short period, and post-COVID-19, what are our concerns, and what are the areas we have a bigger stake. So we know that there are pandemics often happening in the world, and those things are not a new thing. Since time immemorial, we know this kind of epidemics happen, and that is described in Ayurveda also. We are not talking greatly about the virus or bacteria. Rather, we talk about the atmosphere in which the bacteria is easily contracted. All major diseases like, for example, tuberculosis and all, we don't talk about the bacteria. We talk about the atmosphere which becomes conducive for contracting infection. And if the atmosphere is healthier, definitely the infection cannot be contracted easily. This altogether is what is known as immunity. Your capacity to resist the disease is basically your healthy status of the body. And if that is there, I think very rarely you can have a disease manifested or contracted through bacteria and virus. So we just try to see things from the deeper plane. Why virus or a bacteria is entering into the body and creating trouble. We know that of late the virus entering into the body is not creating that much difficulty as it has been doing in the earlier stage. And now our recovery rate in India is very, very high. 93% of the affected people have been recovered. So there are a lot of reasons by which we develop a herd immunity, by which you are able to resist the disease, or even if it is affected, you are able to come out without getting a major damage. But anyway, this is a pandemic and a disease that gets contracted, communicated from persons to person. So as far as Ayurveda is concerned, I used to say this Upasargika Yoga description is there in Sushruta Samhita. So what is easily contracted from person to person? Because of close contact with individuals, what is easily contracted is Jwara. We say Jwaram, Shosham, Kushtam, Netradisham. Kind of diseases can be contracted from one person to another. In that, definitely, Jora is the basic, is the most important, most strong disease which can be contracted from person to person. So this also has to be basically considered as a Jora, in which the dosha related atmosphere we need to assess. So I think it is a kind of Jora. If at all it is creating a fatal situation, then naturally it has to be a Sannipada Jora. You all know. So Sannipada Jora becomes more difficult. Whom it is getting difficult, that is the most important part. Whoever is having a weak immunity or a weak dhadus, according to Ayurveda. Wherever there is a weakness of dhadus, you say generally your body is weak, doshas can be disturbed very easily. So whenever such a person gets a disease like this, Jora, sometimes if proper treatment is not given, it can turn out to be fatal. We know that it is a disease more confined to the lungs, respiratory system. Even in the respiratory system, according to the latest reports, you are having difficulties of hemolysis in the alveoli of the respiratory system. So there is a damage, there is a disintegration happening in the distal part or the deepest part of the respiratory system, where degenerative tendencies are developed. That is why it is difficult to manage that. And reports also say that these tendencies of hemolysis, blood coagulation, can happen even in the coronary vessels or even the brain. It can happen. So that kind of an atmosphere is expected, but there is a degenerative atmosphere created in the body as a result of this disease. Mostly it happens to the lung. It can happen anywhere in the body, according to latest research reports coming from the WHO. So our concern is, how do you look at this? What are the primary doshas we are concerned with? Suppose you are not aware of any of other modern technical knowledges for the time being, how one would have looked into this atmosphere. This is where the role of Ayurveda comes. I'm not against this Western knowledge system. Let it be there. That is a prevalent system. Let it be there. Whatever is useful to you in understanding the body, that can be taken, provided we have a clarity in our own shastra. If we don't have a clarity in our own shastra, all the Western knowledge will be acting as a burden to our science. So I say, just like we all are clear about the Western science, for example, anatomy, physiology and all, that much clarity should be there in our own shastra also. That means based on dosha, dhatu and all, we must be able to assess the body condition in normalcy as well as need. Because our medicines are based on this vata, pitta, kapha, and to be utilized only based on vata, pitta, kapha. So this area also we must have a clarity. Then any kind of a knowledge, Western or any other additional knowledge, will be complementary to what you are doing. If there is lack of clarity in our shastra, any kind of other knowledges will be a headache or a burden in initiating a knowledge process of our own shastra. This is my sincere opinion. So we must understand that according to Ayurveda, we must look about this disease in terms of dosha. So mostly, if it is creating a fatal symptom and all, we have to say that it has a nature of Sannipada Jura effect, in which Vata Kapha symptoms are more. So we'll have to say that Vata Kapha dominant Sannipada nature has to be expected in this disease. Individual variations can be there according to the background diseases. But overall picture is that it is a semi-Vata. That's why it becomes easily fatal. In that, the fatality happens mostly in the Kapha dominant sthana, which goes into lymphatic function. So you get the Vata Kapha dominant semi-Vata, which can easily damage the structures related to the Kapha dominant area. As a result of this, Jwara, which is an inflammatory cause. This is what is basically happening to this disease. And with this understanding, I think a lot of medicines have been generally suggested by Ayush Department of Government of India or the respective state governments. Even in Tamil Nadu, government of Tamil Nadu has suggested few medicines from Ayurveda, Siddha, and all, which are in general targeting the Kapha Vata nature. All those things are fine as far as general management is concerned. It is a specific disease, an individual coming with the infection. Then what are your concerns? How do you manage that? For that matter, we need a clarity on what is Jwara, what are the dosha prominences, then what are the background atmosphere contributing to this. This is how we look at it. So as far as the background diseases are concerned, we all know most dangerous comorbidity, what has shown in this disease, diabetes. Prameha has been the major comorbidity which has ended with fatalities, more fatalities. Of course, heart disease or brain or kidney disorders are there that also contribute, but more than that, Prameha was the major comorbidity which has ended in more fatalities whenever they are affected with COVID-19. So in such an atmosphere, how we look at that atmosphere, this is our primary concern. I'm not going to the details with treatment of the disease now, because that part is over. It's understanding I'm trying to share with. So it should be a Jwara in which your concern is whichever dosha is dominant, accordingly medicine changes. And before finalizing a medicine, we have to look into the background of each person. Accordingly, medicine changes. This is a difference in Western science and Ayurveda science. Western science also it is there, but it's not prominent. And that becomes relevant whenever the patient is recovered from this COVID. Okay. So our concern is identifying the disease based on dosha alone to select a medicine. Okay, you have an understanding of what is infection, what is a fever, what are the dangers of the fever, how important is the temperature and not, BP, pulse rate, everything. I don't deny all those things. In addition to that, we must be able to make an assessment based on Kapha, Pitta, Vata alone, and it has to be considered as a Jwara. I underline Jwara because you cannot wait for a few days to decide upon the medicine. The Jwara is in acute condition. It is not treated well, immediately it becomes fatal. So a gradual, instant inflammatory process. This is Jwara. If you don't manage it quickly, that inflammation will result in the regeneration of the whole body. So we must be able to talk about the dosha domination of this condition then and there. That will be accurate if you can see what is there in the background also. For example, a diabetic person comes to you with corona. Your concern may be acute state is corona, that fever with cold, cough and all. But in the background, we understand that Prameha, everybody knows, I think it is Kapha Sapittam Pavanascha dosha. Basic atmosphere of Prameha is Kapha Sapittam. Sapittam Kapaha. means Kapha is the essence of all dharus. Kapha is the structure of the body. Shuddha Kapha, pure form of Kapha, pure form of Snigdha, pure form of proper Prithvi and Jala. This is Kapha. It is expressed by pure Snigdha content, and Prithvi Jala forms of the structure of it. So the structure is pure Kapha. This gets vitiated with Ushna nature of Pitta. That is what we say, Sapitta, Kapha Sapitta. So the structure is basically weakened continuously in Prameha. This is the meaning. So you have all weak dhabus in Prameha. In that atmosphere, you get a Jwara like this. This is a concern for us. And like this, there are many diseases. So whenever you do something, anything which can weaken the body cannot be done further. Because that will add to the dhatu weakness. Then the capacity of the body to resist the disease will be reduced, and disease will further progress very easily. So to avoid that, we must have an understanding of background atmosphere. And in that aspect, we have a different understanding of many other diseases. That's why I specifically say background disease has to be understood, because that presents a disturbed dosha position, always disturbed dosha position. Then when disease comes, that will be easily complicated with this weakness created by background atmosphere. So we need to be careful with the disease, its dosha condition, and the background of that particular individual. To that atmosphere, we will be giving medicines. If this has been given, I think even many cases, corona active cases, they also happen to treat a lot of cases. Most of them have been recovered under proper rest and all, proper guidance, proper rest, they recovered. So with this background of understanding, what is expected after the recovery of corona? This is our main concern, today's topic. As I told you, the disease for us is not an acute atmosphere all the time. You have disease process starting from Jwara, ending with Vata. Okay. Jwara is an acute inflammatory process. All diseases are basically inflammatory processes, but Jwara is an acute condition. Whereas in Vata, as a result of this inflammatory process, you can have a maximum weakness in the most deepest important parts of the body. This is what we can incur as a result of the disease. As a result of the disease, we incur weakness to different structures. When that weakness comes to the deepest part, it shows that its movement, its functions are impaired. The most important part is affected and impaired its functions, you call it as Vata. In general, we say that disease is a progression from Jwara to Vata, where maximum weakness is established in Vata dominant deepest part of the body. Any disease can gradually lead to Vata atmosphere or rather weakness to different structures in the body if it is not properly treated. In the case of COVID, we all know it is not properly treated because we don't have a direct understanding of the disease. We are treating only the symptoms. If properly treated Jwara and re-establishing to the earlier stage of health, we call it as Prakriti Sthapana. This is what is known as Chikitsa. We bring it back to the normalcy of the body. It's not symptom. Even after treating the symptom, if you bring it to the normalcy of the body, nothing will be precipitated. Otherwise, these atmospheres, acute diseases can gradually lead to weaknesses in different systems. most important system becomes weak and impaired, you call it as Vata. So in general, our understanding is that this is a progression from Jara to Vata Vyadi, where you get the maximum weakness. Beyond that, we cannot have weakness. Beyond that, we can have weakness plus degeneration. Structure can be weakened, then damage also can be done. That atmosphere is known as Vata Shuni. So that is why Vagbada puts diseases in this order. What is relevant now is, as I told you, corona may be acute fever, 1 or 2 days it is over. The cough, cold and all precipitate for a few more days sometimes. Lack of appetite, body pain, tiredness, smell, loss of smell, those kind of symptoms. Gastrointestinal irritation in total has been a prominent symptom reported by many of the people. Those things will be pursuing for a few more. This is how generally what is seen. So to our understanding, these kind of symptoms, if you are not able to treat properly, it can lead to later other diseases in different systems. So we need to ensure that even if corona patient becomes negative and testing, his basically his koshta is brought back to normalcy with a proper Agni. Okay. So if that is done, even with the normal food and all, we can ensure that his body is nourished properly. That is the most important part. We bring back Agni into normalcy. The functioning of the koshta is brought back into normalcy. Through that only you can establish a normal health. It is the most important part as far as Ayurveda is concerned, because Agni is the basic thing we assess. Mostly people assess casually, but it's most important thing. It has to assess subjectively, not objectively. With each individual, how do you feel with your stomach? Are you comfortable with your eating? Whether it's quantity or quality of the food or time of the food, you feel comfortable with your stomach. That shows that your Agni is normal. Otherwise, that has to be protected with medicines, especially after this pandemic. Remember, there is a disturbed status for all the three doshas. Whatever is dominant, whatever is there in the background, Agni can be easily disturbed. So that if that is corrected, the rest of the things are easily getting corrected. We know that as per Charaka Samhita, on occasion Charaka says that Kayo Agni Tasya Chikitsa Kaya. In fact, body is Agni, functionally body is Agni. If that is treated, that is what is known as Kaya Chikitsa. Or rather, whatever we are doing, this is what is happening in the body. We talk in different terms, Lankanam, Pajanam, Vibanam, and all. As a result of all these programs, basically the Agni is getting re-established. Subsequently, all Dhatu formations are enhanced. Whatever food you are taking, it is going to every nook and corner of the body, and the body gets nourished properly. You create a healthy structure again. That's why Charaka says body is just Agni. So that is very relevant nowadays because majority of the people what we see have a disturbed Agni with various reasons, because of food habits, experimentation with food, outside food, junk food, irregular food timings, various categories of. You don't allow the body to get adapted to a method of eating. Before that, you start taking new variety of food. Body is not adapted to a particular way of digesting things. So So that is technically seems to be very helpful. That means you are aware of your body, then you know what is good, what is bad for that. That knowledge is there now. We will look into the food to do wonders in your body. Like this is protein rich, this is carbohydrate, and this is acidic, this is vitamin. You just look to the food to do the nourishment to the body. Instead of that, it will be more important if you just look to your stomach, how far it is healthy, how far it is comfortable, then look to the food so that you can maintain a better health. That becomes relevant in Ayurveda in the context of COVID-19. So what you need to do basically is to see that Agni of that particular individual is corrected. Agni is corrected, partially the Koshta will be corrected. Not totally, partially the Koshta will be corrected, which is the Koshta from which normally the Kapha, Pitta, Vata are generated and maintained in the rest of the body. Okay. Kapha, Pitta, Vata are the basic factors which are responsible for all activities of the body. Right? All activities body are, all functions of the body are confined to Kapha, Pitta, Vata. So if Kapha, Pitta, Vata formation is corrected in the Koshta, it will be reflected throughout the body. Right? So Agni has to be corrected, then Koshta has to be corrected so that Kapha, Pitta, Vata are maintained throughout the body in a proper way to be called as what we say healthy state or Swastha state. We remember Samadosha, Samadhischa. Samadosha and Samagni is the first symptom of the Swastha. So this is what practically we are doing. And Agni, then Koshta. Here comes our understanding. There are a lot of diseases which are considered to be very big in Ayurveda and not considered to be major diseases in the Western science. So usually Ayurvedic people do not care for that kind of a disease. We must understand that when we say a disease, we mean an atmosphere or a syndrome where you have a potential to continuously weaken your heart. Okay. So in a long term only you create a damage to the body. But you have an atmosphere systematically creating weakness to all parts. That atmosphere is known as a disease. You don't have to create a damage to your organ or a system to be known as a disease. Western science is like that. An organ or a system is functionally failing, then only you call it as a disease. You don't wait for that. Systemic atmosphere in which you create weakness to all dhadus. That is a disease or that is a great disease. For example, Grihani organ becoming weak due to eating habits or doing sadhana therapy or lack of food and all many other activities which are not comfortable to the stomach, or you get a diarrhea, you don't treat it properly. So weakness is precipitated. Beyond treating well, you start eating heavy food. Like that, many things you do which are not conducive to the stomach, and one part of the stomach, that is the duodenum, gets weakened, but you continue with your regular activity. The part which has to hold the food for sufficient time for digestion is failing to do that, so that food passes down undigested. This is the disease. Overall, you may get sometimes loose motion, sometimes constipated, and generally tiredness. This is atmosphere, and we say this is a Maharoga. You must understand, Ayurvedic people generally do not believe it. We say this is a Maharoga, or even this is not properly identified. Most of the people coming with constipation as a main symptom would have had a history of Grahani many years back. It precipitates a weakness to the whole koshka, and as a result of that, the Kapha Vada formation will be always in danger, and the nourishment which has to be absorbed from the koshka so always it will be deficient. As a result of that, you always tend to be weak with dhadus. Always there is a weakness in the dhadus, it cannot be corrected. In that atmosphere, if you contract any other disease, so-called disease, it will be very difficult to come out of it. So even this background atmosphere is what we call it as a disease compared to the Western science. So we always calculate that background also, and we try to address that also. Then only the capacity of the body to come out of the disease, to fight the disease, will be re-established. So I say Agni, when I say Koshta, as far as Koshta is concerned, you have many diseases like this. For example, Gulma, Abhisaram, Arshis, Grahani, kind of diseases which are not properly considered by Ayurveda community, my understanding, not seriously considered before deciding about a medicine to be administered. So if these areas are well considered and treated accordingly, any post-COVID situation will be able to recover the individual very taking it to a healthy situation. This is what I just wanted to convey. So that is one of the most important part. Second part, what is precipitated as a result of this COVID impact is any jwara, if it is not treated properly, we know that it leaves a Vata Pitta atmosphere. What do you mean by Vata Pitta atmosphere? You mean that Vata as a dry nature. It's not soft, it's not snita. So dryness in the body is precipitated. Pitta nature is Ushna. Hot nature, hot and dry nature is precipitated as a result of all jwaras. If you say chronic jwara, definitely your whole dhadus will be in an atmosphere of Vata Pitta nature. So what happens if this Vata Pitta nature is not addressed? As per jwara, ghee or milk will be the medicine to sustain the structure. Ghee, cow's ghee or milk, which are fit for Vata Pitta atmosphere. Once jwara is over, these kind of a medicine will be good enough to see that Vata Pitta atmosphere set. If this Ushna Ruksha nature, this is what we say Vata Pitta nature of dhadus, are not addressed, what you can expect maximum Vata nature going to the deepest level, you expect a Vata Pitta. This is what is the result of it. You expect a Vata Pitta, so-called Vata Pitta, or the impaired function to any of the structures, any of the organs or any of the system, you need to expect. So that Vata Pitta atmosphere is a result of the disease process that has to be carefully addressed, considering the background atmosphere of the individual. Okay, there is a diabetes prameha in the background. A very nourishing things like a milk or ghee cannot be continuously given because the nourishment will be aggravating this kleda nature in prameha. So you do a limited way of nourishing, doing brimkhanam. To address the vada, we know that it is snekhanam and swedanam. So snekhanam will be done partially in a limited way if there is a background atmosphere of prameha. Like that, if you just calculate the background atmosphere, somebody with a skin disease, swedanam or induction of Ushna dominant drugs will not be welcome. You need to carefully induce to see that Snehan is proper. So what you are going to do is assess the Arjuni, assess the Koshta, dosha related atmosphere. Most important part is assessing the background atmosphere, and then you address the Vata Pitta atmosphere precipitated as a result of this COVID-19. That means basically you are trying to revive the structural health. That is assessed from this dosha angle. Disease also precipitates Ushna nature. Sometimes background atmosphere also can contribute to that. So that has to be gradually addressed. The most important part in this Vata Pitta atmosphere is that it can also contribute Vata Pitta nature to the mind as well. Okay. So 3 days back, I have seen the report from WHO that 90% of the COVID recovered patients are having anxiety, sleeplessness, and depression. And most of the big hospitals started making post-COVID clinics. As a result of this ongoing research for the last few months, they found out that COVID recovered people are having anxiety, depression, and sleeplessness as a main complication precipitated by the disease. So people have to be careful about it. We were very clear about it because we already tested these kind of things. The Vata Pitta atmosphere, which is a weak status of Dhatu, based on the background disease, we need to improve that. This is your overall duty. Same Vata Pitta atmosphere, that Vata, if that is going, that is getting disturbed with the Prana Vata, which is well connected to the mind. We say Pranasya Chittavada. Okay, Pranasya Chittavada. Vata atmosphere in the body can disturb any of the Vadas, and in the 5, accordingly, you can expect difficulties in different parts of the body. If that is getting interrupted with Pranavayu, it can reflect in the mind also. Okay, then you can have a restless, irritable mind, which can induce lot of thoughts. It can trigger the speed of thought. So you feel irritable, restless, thoughts can be there continuously coming. As a result of that speedy thoughts only, you call it as anxiety and all. There are conditions resulting from the lot of extra thoughts. We know Chinda, Shokam, Bhayam, all are Vada provocation. In the first year student will be understanding this. Chinda, Shokam, Bhayam. They all are coming under this Vada provocation in Nidana. Okay. So these things, Chinda is excess of thought. It can be provoked from a Vada atmosphere in the body. As a result of Chinda, something goes against your calculation, you feel depressed. This is Shogam, in which also you get a lot of thought process going inside the body. We all know, but if fails in exam, you feel down. Down in the sense mind is not inactive, mind is very active inside. You'll be thinking a lot about different things, lot of thoughts, positive, negative, everything will be coming into the mind. But that status of feeling down is known as shock. It also implies that a lot of thought process is going on. And with that thought process, mind will be moving to different areas. Along with the mind, you see that Vayu is also moving. Chinta, Shokam, and as a result, Bhayam. The conditions we call it as anxiety, fear, agitation, different ways. What we are concerned is that the thought process is happening at a higher pace in your body. with the thought process, mind is moving with body. Again, it creates an atmosphere of vata in the body, or atmosphere of vata in the body can create an atmosphere of vata pitta in the mind as well. You remember again, Charaka says, Unmado vata vyati vishesha. Unmada is a particular type of vata. So we need to expect if there is a vata pitta atmosphere in the body, we need to expect the impact on this body as well as in the mind. Okay, so this is very natural for an Ayurvedic physician to calculate in this line. Only if you see directly people, to my experience, last few months, whatever type of patients are coming, an impact of stress and fear is too much. Or what is complicating the existing disease is too much of a stressful, tensed atmosphere as a result of this pandemic and subsequent lockdown. Okay. So this we are directly seeing, but it is well supported with the theory which we are working with. So if you are able to address this kind of things, I don't specify diseases. We must remember that are you precipitate in the body typically in a condition like abscess. I always in all classes. Abscess is important for Vata not being able to move downward smoothly. This is overall picture of abscess. And while is moving downward smoothly, there is no problem. It shows that the costa is moving properly. The rest of the movements of the body are very smooth. In abscess, that movement is hindered by the fleshy growth in the rectum and anal canal. So since Vayu is a mechanical force, it can move any plane, and accordingly you can have different difficulties in the long run. It is going back straight up and interact with the pranavayu. Naturally, its symptoms will be shown in the mind also. So according to Vagbhada, the basic symptom of abscess is anavasthigatvam. Anavasthigatvam is restlessness. You must understand restlessness. Avasthiti you don't like. Sitting quiet you don't like. Always anavasthiti you like. So restlessness is the basic symptom related to abscess. So this is what I was trying to explain in a different way, how you can have a disturbance in the mind, and that is very well established in the context of pandemic. So if you are able to address the agony, kosta, background disease based on doshas, and subsequently the mind, which is the deeper plane of the physical body, that also has to be addressed. I think the post-COVID complications can be well managed. This is what I feel. If the kosta is managed, I think half of the problem is over. This is what I see. And just coming back to what is explained in Ayurveda thousands of years back, just to validate my understanding. This is my understanding based on Samhita. So this is what I've been doing in my practice to deal with conditions like this. Whether it's acute state of COVID or a post-COVID situation, this is what we have been doing. And even the beginning March itself, I happen to be a part of the COVID research program in Stanley Medical College. So I used to say that at least 2 months you need to continue with medicines for all patients who got discharged. And we were managing also that. We were trying to continue the medications even if the patients were negative. So we were expecting that this weakness created in the body can end up with a different difficulty. So till that all is covered, you should not stop the medication. That has been our understanding, even without doing any kind of major research. These are just pure imagination based on Shastra. And if you just look into Shastra, what is told in Shastra, I think most of you would have heard about this Charaka Samhita, where this pandemic is described, Janapata Dhamsani. A very overall picture of what is that chapter about. So in the beginning I said pandemic and all these kind of atmospheres are there since the human inception. Everywhere, whatever is common to human beings, when that is vitiated, you can have a group of people or a village or a society as a whole easily getting affected. You say Vayu vitiated, Jala vitiated, Prithvi vitiated, Kala vitiated. Whatever general impact is there on a group of people, we can have it. And as a result of this situation, if you are getting a Jala, it can easily spread from one person to another. This overall understanding. So what are the basic solutions for that? You ensure that you migrate from the affected area. Keep away from the affected area or affected person. Right? That's a basic thing. Wherever you get pure water or you get pure air, in those days you need to migrate. Now we try to see that water is clean or whether it is sanitized or whatever they use, clean food items, vegetables, fruits, clean very well. Ensure that you get a cleaner atmosphere. We are doing it from a different atmosphere. That's all. Those days it was not possible, so you migrate from that place to another place. So there's a good water, good air, like that. Second thing, treat the disease, whatever is happening. You are supposed to collect the medicines before this pandemic happens. So those medicines will be purer, purity is strength. Before all this happens, if you have medicines collected, with that medicine you can treat, which the effect will be more. So even you ensure that your atmosphere is in tune with the external atmosphere. Your atmosphere is very well connected to the nature. So nature is also preserved. Collect medicines when the nature is very healthy, comfortable, so that whenever you require, you get a purer variety of medicine. Use that and treat it properly. Third thing, to maintain the health. This is what exactly told by Charaka. Do the proper Panchakarma. Shodhana. 5 Shodhana kind of treatments. You do it. Before doing Shodhana, you need to strengthen Purva Karma. Snehasweta, you are doing to strengthen, to make the body very smooth. Then you do the Shodhana therapy, whatever is fit. Then again, as a Paschat Karma, you strengthen the body. That means we know that body is just water, Jala. We call it as Ambuyuni. Prithvi is the matter, Jala makes it life. It is this Jala atmosphere which is getting corrupt. The Jala atmosphere we are trying to purify through this Panchakarma. Jala is taken out smoothly, and whatever Jala is added back, it becomes pure. How do you feel it? You feel it through the basic property of Jala, which is Snigdha. So the Snigdha nature of the body shows that your Jala is pure, optimum Snigdha. So whenever you do a Shodhana, you are taking out the Jala. Before that, you need to ensure that you have enough Snigdha content. That's why we are doing Snehan. So structure is strengthened. Then when the Jala is taken, it will not be dry. It will not be precipitated with the dry. Then whatever Jala is added, it will be pure Snigdha, which is basically your health of the structure. So whatever Panchakarma is needed, it also has to be mentioned that you don't have to do all Panchakarma. That is basically wrong. Whatever Panchakarma is fit for that particular individual, you can do it safely. Ensure that you are not disturbed. You don't have clarity in certain areas, don't do it. For example, if Agni is weak, any kind of sadhana is contraindicated. Not only sadhana, even a mukhaleba is contraindicated for ajirna yoga. Any karma is contraindicated. It's a technical thing, but all sadhanas are contraindicated if Agni is weak. How do you know Agni is weak? All these diseases, what I mentioned, what is discarded by us, like Ursus, Sadisaram, Grihani, Gulmam, Pandu, and all, continuously Agni is weak. You are not supposed to do any kind of sadhana. Okay. So if you are doing sadhana, you need to ensure that this patient is fit for that. Otherwise, it is better to avoid sadhana. We can deal with samana also. So when the book says about a perfect thing, perfect treatment is sadhana. That is not possible and should be fit for a perfect individual. That is not possible. Samana is also done. So what Charaka says is just do Panchakarma properly so that structural health is reestablished. This is how you deal with pandemic. Okay, you migrate, then you keep personal hygiene, cleansing it down. Then social hygiene, whatever is needed, you just ensure that your body is clean. Then a question of how to strengthen that, how to re-establish the habits. Unwanted things are taken out and pure things are induced. This is the effect of Panchakarma. This is also started explained. And the most important part is that Charaka says during the pandemic, you need to be in the righteous mode. Dharma. You have to do as much as possible, you have to be in dharma mode and involve in religious and ritualistic activities. Lot of description is given about it, how you become passionate, how you get benefited by donating things, daya, dhanam, dharma, kind of things. Whatever religious activity or ritualistic activity is separated because religious activities are routines and without the involvement of mind also people can take part in it. The puja is going on, Homan is going on, I can just go and sit there and think out many other things. Even that has an impact in you, in silencing your mind, calming down your mind. When you say spiritual activity, other than religious, you involve in such activities with the presence of mind. You are concerned with how far I feel comfortable inside. Okay. So you feel the effect of such things, knowingly you are involved in such things, all sorts of religious, ritualistic activities, like homa, puja, all kind of prayer, meditation. Wherever it is necessary, you need to involve in such activity so that the speed of the mind is restricted. Mind is projected outside, it runs forever because it has got innumerable objects to ponder with. It will never stop thinking about an object because your field is with innumerable objects. The mind is projected inside, you have only one object. So any activity with which you can see that your mind is put to one pointed attention, everybody feels comfortable. It concentration, meditation, prayer, whatever. All these things are an attempt to see that mind is brought to one point of attention. It means that the multiple, innumerable points, it is not running. Now you are bringing back from this innumerable objective field mind is brought back to one point where you feel comfortable with the mind, or rather that is a natural state of the mind, or that is a strength of the mind, then you are not prone to any kind of response. Okay, irritation, restlessness, agitation, frustration, anxiety, fear, whatever. Nowadays people talk. All these things are not diseases. Robesha, Veshama, Raga, we say this is not disease in fact. These are atmosphere in which you can create a change in the body to get a disease, a change in the mind to get a disease. So these are all conditions which are not very healthy. Okay, these are all what you say disorders, you can say it's not disease. If you are not careful with that, that's why people do not address anxiety and all. A lot of people are having anxiety, tension, easily get stressed. They don't address because of disease. But it can lead to a disease. It has an impact on the body as well as mind. For example, most of the skin diseases, we call it as kushta. In the background, there should be an agitated atmosphere. Major skin diseases like psoriasis. Agitated mode is a must, and it is what is creating an aggravated pitta atmosphere. And the role of the mind is very prominent. The disease will be very difficult to cure because you cannot have a direct access to the mind. So a dysfunction in the plane of mind is already expected in the atmosphere of panic. Everybody gets fear. So everything you have a fear. To purchase a vegetable, to take a bath, to get a paper, even newspaper. You are afraid to get a note, rupee note, you are afraid how to touch it. That much fear partially was created by the media highlighting all these things. Partially, naturally, our mind is sensitive, so we take things with double imagination. So to see that your mind is made comfortable, these kind of descriptions can be seen in Charakasana. So in fact, what we wanted to see that in the post-COVID condition, so these atmosphere of provocations are understood by an Ayurvedic physician. Each individual, he can see that his Agni is corrected, Koshta is corrected, Tridoshas are made in the balance, considering the background atmosphere of each individual. Please don't generalize because individuals are different. For Ayurveda, medicines are also different. It cannot be same medicine. So you treat the individual body. Agni, Koshta, Tridosha are managed. Then your next part is the mind, for which there is no direct medicine. These kind of things are always suggested, or rather we know that mind medicine is Bhidai Atmadi Vijnana. Atmadi Vijnana means a knowledge about myself, knowledge about my body, knowledge about my mind. So your mind is focused towards inside instead of focusing outside. So when you try to understand yourself, that much is your strength in the plane of mind. And mind will not be running to create disorder. What I wanted to say is that whatever we are doing to deal with that kind of a pandemic nowadays, knowingly or unknowingly, whatever is described in Samhitas are put to the test. We are exercising those kind of theories from the Shastra to ensure that this is put into practice to create a good result. All those knowledges were more prevalent in the olden days. Now it is comparatively less prevalent, or we are not looking deeply into the descriptions or reading in between the lines to get a clear picture of what acharyas have told in those days. So as students or even as teachers of Ayurveda, as Prime Minister today told in the morning, our commitment to the society, global society. It's not a question of India. In the human world, your commitment to create a healthier society is now very much relevant. It was an address to the entire Ayurvedic community. I also joined with that louder call to see that our Shastra is brought back to its old, what you say, that golden era, and its full benefit is to be explained to whoever is coming to deal with Ayurveda, and to the contemporary medical science also, it has to be conveyed so that people at large is getting benefit. With these words, let me conclude. Time is already a little late, and I request you people to ask questions if at all there is any. Hello?
Sir, good evening, sir. Kritika
Yeah.
here.
Yeah. If any questions are there,
Sir, whether have you seen any patients other than this three symptoms, other than this manasika avastha, any other symptoms in
definitely.
post-COVID?
Definitely. Most of the people, I have regularly one allopathy doctor is sending post-COVID patients to me because they feel very exhausted with body pain, lack of appetite, and always indigestion, like acidity, bloated feeling, constipation, or loose motion. And subsequently, you feel unnecessarily tired and sleepy. Most of the people I got is having this kind of atmosphere. So we can put it in many other diseases like a condition of Gulma, like a condition of ulcers. That's what I say, the Vada atmosphere. I didn't mention specifically body pain, exhaustion, and of course even little dry cough can be precipitated. Dry cough can be precipitated. Specifically Vata Pitta mode of cough. Kasa is not completely cured, so dry cough can be precipitated. Then sleeplessness, tiredness, lack of appetite, and bowel movements improper, either loose or constipated, incomplete, bloated feel, hyperacidity kind of symptoms are most of the people are coming with that kind of things. With our medicine, I think 1 week, 10 days, they almost become normal. And one allopathy doctor is regularly sending me post-COVID. With our medicine, everything gets very, very fine. But still, I say you need to continue at least for 1 month, 1.5 months, because to see the impact of a major disease is completely different. And doing
Sir,
it.
actually,
uh,
we had actually AVP and other people, they did this clinical study in Stanley. And so one
yes.
group of people is treated only with allopathy and mixed treatment and exclusively Ayurvedic treatment. So
No,
among
it was
these,
not like that.
it was not
One
like that.
was with allopathy and Ayurveda, one was with allopathy alone. It was basically one of the best studies conducted in India as far as the interdisciplinary research is concerned. As an add-on therapy, Ayurveda was introduced, and other group also was subjected to same study, evaluation of most of the allopathic blood tests. All parameters were tested in both groups, including CT. All inflammatory markers were regularly tested first day, 7th day, 14th day. And we found out that wherever there was add-on therapy of Ayurveda, recovery rate was a little earlier, of course. The inflammation was gradually coming down. Health of the patient was better. That means we just come to the conclusion that immunomodulation is easily happening with Ayurvedic medicine, whereas they are using anti-inflammatory medicine like steroid and all, which works to reduce inflammation but help is not. And allopathic medicines, those groups were having a little later delay of recovery. Our immunomodulation was very, very fine with Ayurvedic medicine. This has been the conclusion of the study also. Still, that they are working on that. But as add-on therapy, we were giving Ayurvedic medicine. And they don't have a direct medicine as such. They were giving basically sometimes minimum steroid. Otherwise, if there is fever, zinc vitamin kind of things, or remdesivir. Some people it was remdesivir they were giving. None of our patients were had to enter into ICU or ventilator. Even though we adopted patients with comorbidities, severe diabetes, more than 7 and 8 HbA1c, and of course lung damage, 20-25% lung damage. We were trying to get that kind of a patient. Lung also recovered almost completely within 2 weeks of time. All symptoms disappeared. It was just to see that, it's not easy to get such a study in India where a lot of people look at Ayurveda as a system to be competing with. Because the ego, people will not be open for this kind of study. Probably with influence in higher ups, we were able to get it with their complete support. Rather, they took us to the entire study. Initially, they were resistant, but again, pressure from the higher, they were open. Along with us, our people were going for rounds. All kind of parameters were taken by our doctors. Everything was permitted. That study was done at every interval, and we ensured that all those data are collected in huge numbers. It was one of the best studies, I think, to my understanding, as far as interdisciplinary research is concerned. Otherwise, many people have done studies. They were just watching only for one of the inflammatory markers, like D-dimer and all. Competitor studies done it. Many people are doing it. But this has been based on our black box permitted, 10, 15 medicines were permitted. Just not one medicine. According to the symptoms shown by the patient, we were able to change things according to the dosha conditions and make an effective change. So it was an Ayurvedic treatment we were trying to do. It was not one medicine. Pitta elevation is there, Drakshadi Puducherry was permitted. In whatever condition, we give it for 1 or 2 days. Like that was done. And then the result was actually created. We don't say drug-based, and they also permitted. It's not drug-based, it's a treatment. You are doing it, you are applying it intellectually, then result was created. All other studies are basically drug-based. They just try to see that Guruji is effective, the other one is effective, like Kabajara Kudini is effective. They are drug-based researches showing result then and there. Some other condition it may not work. That's why they don't agree with it. This time it was not drug-based. It is your intervention, Ayurvedic intervention according to the situation then and there. Contextually potentiated medicines according to dosha understanding. It was permitted and we were giving it. Even extra time we were giving kasayam and all if needed. Like that, better Ayurvedic exposure was there. They were also happy with that. A good result was there.
Sir, as you always say, the medicines differ in Coimbatore as well as in Chennai, based on Desha, Anupadesha, Jangala Desha. So in this COVID also, whether we have to prescribe different medicines based on the Desha. It may be different in Kerala.
Yes, slightly we need to change. So that basic understanding is that you try to induce a medicine to the dosha. Okay, dosha assessment you are making. The doshas are influenced basically by the desha. Okay, in a hot climate, naturally that heat has an impact on your body. Doshas are either Ushna Shidar related or Snigdha Ruksha related. This can be influenced by your desha. That's why Dushyam, next one is Desham. Dushyam, Desham, Balam, Kalam. That's how you are supposed to assess a dosha and a medicine accordingly. First, it is the body. Dosha you are assessing based on dosha. Then impact of external atmosphere on dosha. That is desha. So in a Ushata Bhumi, if you have to induce a Ushna thing, you expect Kapha. Minimum Ushna can be induced. you cannot have extreme Ushna. When you do what is a Svedana, for Vata you need Snedana and Svedana. Svedana you have varieties. For example, the Churna Svedana is very hot. Patra Svedana is lesser hot. Even Patra Svedana you put coconut, then again heat is reduced. Shastika Pinda Svedana is again less hot. You have varieties. Even in Thaila, you have varieties. Dhanwanthari Thailam with four times milk is less Ushna. Sahajraj Thailam with equal milk is little more Ushna. Or Panchamala Thailam or Kotanjukari Thailam without milk at all, curd and all, is very Ushna. You can grade medicine or treatment or even medicines. Kasnadi Kashaya, big, is hot, good for Vata Kapha. Nowadays, we see Dasna good good. It's hotter. Dasna is less hotter. Sometimes I used to add Dhanwanthari Kashaya to Draksha to ensure that Dhanwanthari is not disturbed. So you have a lot of options, but whether you have an atmosphere to be assessed with based on doshas or not, this is only right. We have all medicines. Before using it, should be in tune with what you understand on the body, what you observe on the body. Medicine is good. All medicines are good. So assessment of the body is based on dosha. Assessment of the medicine is also based on dosha. And first inside the body, next external atmosphere. Then it is desha. Then kala. Desha is the place where you are living. Its effect on ushna, sida. Its effects on snigdha, doksha. Based on this only, you are doing all treatments. All treatments comes under these four categories: Brumkhanam, Lankanam, Swedanam, Stambanam. All treatments come under this. It is connected to Snigdha, Ruksha, Ushna, Sita. So external impact also, when you calculate, it becomes very subtle and more accurate. You can't blame this medicine is not effective. Not our medicine, it's our calculation which goes wrong. So duration is very important. Internal medicines also, you need to calculate if you are using it in a Ushna place or in Ushna atmosphere. Your requirement is Ushna, but if it is Ushna Kalam or Ushna Desham, it has to be used in a lesser grade. That's the meaning. Otherwise, we don't get the result. That's it. The climate is just like that. Every 2 months, the external atmosphere is getting adjusted by itself. We call it a sadharana nature. Probably you have a better freedom or kindly use it without creating a damage. If you go to other places like Tamil Nadu or North and all, same pattern is followed, it will not create system. That's why it has not been successful. You can do all panchakarma and all, there is no result. When you just reciprocate it without calculating it.
So there is another question from the participants.
Yeah.
If the patient undergo Ayurvedic treatment affected by COVID, whether he or she gets post-COVID complications like shoka, bhaya, and depression?
No, even for that also you need treatment like panchakarma. All mental diseases, panchakarma is generally done to see that Vata-Pitta atmosphere in the body is subsided. So provocation in the body can be addressed through panchakarma. Then to the mind, once body is better, Vata-Pitta is addressed, mind will be partially pacified. Then to that kind of shoka and all, we need to talk about it. This is what you say Atmadi Vijnana. You need to talk, you need to discuss, you need to convince what is the normalcy of mind, how natural it is, how you are complicating your mind. This you need to talk and convince. There you need a little philosophy. Through philosophy, little psychiatry, not modern psychiatry. Through philosophy, you need to do this psychiatric counseling. This is what you are convincing. Natural state of mind. When you are in sleep, you are very comfortable. No? So your natural state of mind is not disturbing. And what is the disturbing? You create an artificial mode for your own mind, then feel disturbed. So this is how you try to convince about what is your mind, what is beyond mind, what is your body. And they have a tendency to analyze themselves and ensure that they are in a comfortable zone. That you need to ensure. And of course, the spiritual, as told by Charaka, it is not very intellectual person. A blunt religious ritualistic activity is the best thing, where you try to keep your mind in one place. If you are a very intelligent person, you need an explanation for this, then it is not a spiritual. Atma Vijnana. The ordinary person, even a blunt spiritually or a ritualistic activity, just ask them to go to temple every day. That is enough, where the mind is brought to one point of attention. So these disorders of mind can be granted. So this you need to tell, convince them, then make them do these things once the body is made healthy. So Panchakarma does that on the body. Your talk make the changes in concepts of mind.
So when a patient is affected with COVID, for example, we say Vada Pitta predominant Sannipada Jwara, when his mind is Vada Kapha. Even in that stage, if his mind is restless and all these complications are there, whether the pranayama and dhyana has to be done during COVID or post COVID?
During COVID also, I think it is fine because many people do not have major difficulties in the physical field. Such people can do it. Pranayama, unknowingly you are regulating Vayu. Its impact will be seen on silencing mind. Dhyanam, you are knowingly doing a meditation, focusing on one object. It's good anytime, it's good. Difficult times, people always call for God, no? It's knowingly, unknowingly you do it, it's always good. Whether there is COVID or not, all diseases, we know that many of the deaths are actually due to fear cause. Not be asymptomatic people. I saw one young gentleman admitted in the evening he was admitted, morning 22 years. COVID positive admitted, morning 10 o'clock he just fell down and died. No disease. So all doctors were just wondering, we don't know anything about COVID now. This also happens sometimes. So fear can create death very easily. All systems can be held together. Here, full stop through mind. Fear is very acute, then it is dangerous. And all death, I think that has a major role in creating the vata. It can be addressed when during COVID. After COVID also it is relevant, unless he is on a major physical weakness.
So it means those who are under complete Ayurvedic medicines and pranayama and meditation, whether they are less prone to post-COVID complications or they don't get at all.
Yeah. We are 15-20 days of medication, they are back to normal. That I have treated acute COVID conditions. Patients in our circles, when they got COVID, they prefer to deal with Ayurveda. So we were treating it over phone, over video call, and all we were dealing with that. Even people having complications like asthma and all, we were dealing with acute fever and all. It is their choice. So they prefer because they know us very well.
Actually, we heard one of the hospital in Delhi, they are treating COVID patients only with Ayurvedic treatment. National Institute.
This happened in our All India
Ayurveda.
They did it, but the thing is that the medicines were given many quarantine centers, COVID positive quarantine centers, mostly asymptomatic. Okay. then you can generalize. Here also Kabajira Kudumi was extensively given. Even police hospital they gave. They ask for our medicine also. So we also can give generalized medicines. If it is asymptomatic, COVID positive, it was given, and 5-6 days it was recovered. An acute condition with complications, you cannot predict generalized medicine. For any disease, if this medicine cures that, that is not there in Ayurveda. You are treating the body, there is background, dosha condition, then and there, then only you can do it. Dosha Ushadha improvement. Sushma Sushma Samishesha Dosha Ushadha. The next day there is an extra cough. You need to change it. You can't say this is the medicine. No. Next day there is a loose. You need to change medicine. Otherwise, third day will be more difficult. That unknowingly we are doing it. But in fact, if you say generally, specific conditions cannot be treated. Asymptomatic COVID positive can be given. Otherwise, as somebody with a lot of wheezing, lot of cough, lack of appetite, acute weakness, sleeplessness, and all, one medicine will not. But you can't predict this can be given. I have treated 2 days. He remained just on the bed without taking food, only one water. Cold fever. Fever disappeared within 1 day. Just another and then his appetite didn't resume. He didn't take food. Just lie down, desperate. Third day I called him. Then he said, no appetite, so I just lie down. I didn't get up. I'm very tired. Otherwise, no cold, no fever. And I said, you should have informed me. I said, you take Vidwadilation every 2 hours, quarter teaspoon. Next day, he started eating hot. He was diabetic. So how can you say Vidwadilation is fit for COVID? No. To that situation, whatever is fit, we suggest. Whatever is seen then and there, that is real and that has to be confined. Avasthaja Pradadvida. Dosha, you are assessing its avastha then and there. If you are not assessing, medicine may not be comfortable. That's why generalization is not working in Ayurveda. Individualized medicine is needed. Even Western medicine also is going to the pharmacogenomics. It's a question of individualized medicine. For us, it is individualized because we are treating body. Each body is different based on what. Especially background disease. This is what I was trying to insist. In Ayurveda, you are supposed to see what is the dosha atmosphere in the background. It can be related with the so-called diseases in Ayurveda, whereas modern science, you are fine. You have a gulma, modern science doesn't care. But we are concerned. In Grahani, you cannot do virajana, you are concerned. Prameha, you cannot do so, you are concerned. So background you are seeing, Prameha, a person getting a cough, you cannot do a lot of svedana. It's not very good. That's it. And Pitta related cough, kapha, you are getting cough. Ushna things, Trigadu, you cannot use. Dry cough. All Ayurvedic people are using Trigadu combinations for cough. For 80% the cough medicines are with Trigadu. But if you have a Pitta related atmosphere, Pitta related cough, none of this will be working. Medicines like Vidayadi or any medicine with Hinduvana with milk or even little ghee alone will be effective in dry cough. Dry cough is Vata Pitta. You cannot use nothing which is fit for kapha. This is it. So how can you say it is just dry for everybody? No. Sometimes it has to be changed. If you speak about medicine for this, that's allopathic mode of thinking. We just talk about doshas, then and there you observe and adjust. Then the mode of thinking is Ayurveda. This is my opinion. Fine.
Thank you, sir. After a very long gap, listen to your class. Thank you, sir.
Fine. That fine. can wind up. That's fine. We can conclude.
Yes, sir.
Yeah.
Further questions can be put up in the chat box. Participants. Things like art never comes from having all the answers. It comes from being open to all the questions. Thank you, sir. Today is one of the remarkable sessions for us, for the entire gathering. And that marks the end of the question and answer session.
Challenges make our life interesting, but challenges like COVID-19 push us to our break point and sometimes take away our dear and near ones. Certain losses, like the untimely death of Krishna Kumarji, leave us with lesser spirit and direction. Life has to move on. Manava Seva, Madhava Seva. Serving mankind is serving God. Coming together and pooling our resources to serve the sick and the poor should be the best way to show our reverence to all the souls we respect. On the occasion of Dhanwanthari Jayanthi, we should all be happy for being chosen by God to help the suffering masses. On this day, we should renew our pledge to make our parents and teachers proud by offering our professional service in the most humane manner. We wish you a prosperous Dhanteras.
At the end of the session, let us take a pledge on this delightful day. Pledge to make Ayurveda an integral part of daily life and thereby enable good health and well-being for myself, my family, and my community in harmony with nature.
Now, it's time to express our gratitude to the gathering.
I deemed it a great honor and privilege to close the oath of thanks on this memorable occasion. First of all, start by giving a glory to the Almighty for making this today's occasion a resounding success. First and foremost, I thank our special chief guest, Mr. Jayakrishnan sir, Chief Medical Officer, Arya Vaidya Pharmacy, Santa Ayurveda Hospital, Chennai. Thank a well-wisher, a principal of Nanda Medical College and Hospital, Dr. Kritika, for her untimed support for this function. My heartfelt thanks to our various staffs and faculties for your guidance, contribution, and encouragement in all our efforts. I thank all the distinguished invitees present here with us. Last but not the least, I thank my friends for cooperation in function a resounding success. Thank you all.
COVID will reshape our world. We don't know when the crisis will end, but we can be sure that by the time it does, our world will look different, very different.
The secret of crisis management is not good versus bad, but it's preventing bad from getting worse. Advanced wishes to everybody from our entire team. May this divine light of Diwali spread in your life peace, prosperity, happiness, and good health. Let us all meet again in another interesting session. Till then, it's me, Rupika.
Tejashree and our entire team signing off. Thank you all.
Thank you.
Thank you.